unfortunately, like you can hear there, background noise is easily picked up by these microphones and telephones, and it can be distracting to everybody else that's participating. At the end of the presentation, we will open for questions. At that time, you'll be asked to send me a note using the Q&A function. You can submit your questions by typing them in, or let me know and we can open the microphone and let you talk at that time. Also, recommend that you close any email programs or other programs you may have running in the background. Keep your browser open for the meeting, but close any other programs to prevent you from losing connection with the webinar as we go forward. We expect this webinar is not going to last any longer than 45 minutes, but I'll make sure that we are available if you have questions specific to your institution, and we'll be available by phone afterwards as well. So we'll begin shortly. If you'll give us just one moment, thank you for your patience. We want to make sure a couple other folks have the ability to enter the webinar. Okay, we're going to go ahead and get started. I want to make sure we're respectful of your time today. First, thank you for taking the time to participate in this webinar today. The purpose is to review actions that each institution should have taken today. From the information that we're seeing, all of you have done a lot of these, but we just want to make sure and provide you with some general information. I want to start by thanking each of you on behalf of the Chancellor and the Board of Regents for accepting this role to be the coordinator for your institution. We really hope that all the preparation and planning is not going to be needed, but it is important that we are prepared and be ready to respond if needed. I want to give you a little background of what we've been doing at the system level, kind of where we're at today. We've been coordinating with the Georgia Department of Health, as you know, and our private institution partners as well. It's been very critical that we coordinate with the Department of Public Health because they have the legal authority as well as they have the responsibility to make sure protect the health for the community that we all serve. So we work closely with these folks, who is in turn working with the Centers for Disease Control. Of course, as you're aware, some of the things we've been doing, we've been scheduling information webinars, and we've been distributing information as it's received. Sometimes that information is distributed directly to a specific group, such as health, public safety, or working through Doug Podel at our main office with the coordinating with the international programs that we have at the campuses. So kind of as an update of where we hope all the institutions are, what things you've done today. So we hope that everybody's had the opportunity to review and update their existing infectious disease plans. We want to make sure that everyone's aware these plans still should cover other infectious diseases. A lot of these plans started in response to the pan flu a few years ago. SARS, meningitis, these are all things that we still deal with on campus and may still have on our campuses today. So as you look at your infectious disease plans, don't restrict them specifically to Ebola, but look at these other areas as well and make sure they're refreshed and updated to reflect any responses that your institution needs. This is also a great time, if you've been meeting with your groups on campus, is to make sure you update contact information, clearly identify the roles and responsibilities of the individuals that you have on that group or working committee. The second is to establish a campus community contact. We've been seeing you've been contacting us to review your notifications to the community. To our knowledge, everybody has completed that. Again, we want to thank you for serving in that role as the contact person. This is important because you're also going to serve as a liaison with the Georgia Department of Public Health to receive information. At our last discussion with the Department of Public Health, if they have a student returning to Georgia through Hartsfield Airport, they will notify us, and we will in turn reach out to the institution that's affected by that and let you know who the student is and what the requirements are as established by the Georgia Department of Public Health. The second part is liaisons are expected to monitor information regarding travel and updates. And the updates come from the Georgia Department of Public Health. As you know, in a lot of our webinars, we haven't been recording these because this information is changing rapidly on a weekly basis in a lot of cases. So we're kind of concerned that we don't want to record something that you refer to and that information is outdated. So it's important to continue to check the websites. As soon as we get any changes or updates, we'll try to let you know, and we'll send that information out using Basecamp so that everybody can see the changes that are out there. One thing I want to make you aware of that you may not be, we have shared information with police at your campuses, your institutions, or public safety departments. They've been provided with a briefing document on the enforcement of quarantine and isolation of individuals. The real important piece to this guidance is that the Georgia Department of Public Health must guide any enforcement actions. And so we've tried to make this clear, not only with our officers, but to make sure that you understand that we do not have the ability to enforce any of the quarantine, those type actions without the Department of Public Health issuing those. And so our police departments and local police departments as well have been provided with that information on how they respond and what their legal authority is and is not. So that information has been shared with them. Now, when we talk about returning travelers, just kind of a brief review of what we have from the Georgia Department of Public Health. This time, they will evaluate the travelers that return to the airports, and of course, you're aware Hartsfield is one of the designated airports. They will divide them into three categories. Category 1 is a high risk, and that's an individual that will be quarantined as a designated facility. The Department of Public Health has identified facilities, hospitals, and ambulance services that meet the requirements to handle somebody who may be infected with the Ebola virus. So the Department of Public Health will handle those individuals as they return to the United States. Category 2, low risk, basically the individuals here have traveled from an affected country, but they're not exhibiting any signs or symptoms and have not had any direct contact. Again, this is done through an interview process at the airport. These individuals will sign a monitoring agreement, and that requires them to report once a day to the Georgia Department of Public Health. And they can do that through email or phone to provide them with an update of their symptoms, of anything they may have. And I'll talk a minute about how they're going to help monitor that. Category 3, medical personnel. These are folks that have come from an affected country that have been there working specifically with Ebola patients. They will be visually monitored, have video or home visits to monitor their symptoms, at least for the 21-day incubation period. I will share with you that the Department of Public Health is looking at maybe even going beyond the 21-day period. Some of you were in the webinar with Dr. O'Neill last week, and he made a comment that they may even look a little bit beyond that. But again, that's a call that the Georgia Department of Public Health will be making at this time. Medical personnel, they will look at those on a case-by-case basis to determine the level of quarantine or isolation they may request the individual to participate in. And again, that's done through a signed agreement as well, and they will provide them with a care kit for them to report their symptoms, their stats each day. Excuse me. The care kits that the individuals in Category 2 and 3 will be issued include a digital thermometer. They'll give them directions on how to use it appropriately. They will be given a health advisory for the Ebola care kit. Basically, this will tell them what symptoms to look for, things they need to do, and to increase their awareness so they can report accurately to the Georgia Department of Public Health at least once a day. The symptom card and symptom log will be there as well. It also includes a list of state health department telephone numbers for the individuals to report to in the event their symptoms change. And there will be instructions on how the Department of Public Health will be monitoring the individuals. Again, they will work with them as they return to the airport and provide this information and discuss with them what they're supposed to do. In the event somebody's going to be quarantined or in isolation, there is a written order that will be given to the individuals. And our hopes at this time is if that individual identifies themselves as being a student or a faculty member of one of our institutions, the Department of Public Health will notify us so that we can be aware. I have uploaded a copy of the screening tool for health clinics. If y'all have not seen that on the Department of Public Health website, it's been uploaded to Basecamp workspace, and you can also retrieve it from the Department of Public Health website. It's very important if your health clinics do not have this already. They've had some webinars on what they need to do for screening individuals that may present symptoms. But this is a quick little guide, something they can print out and have available to their staff to assist them in evaluating individuals that may come to the campus health center. Now, I did want to take a moment. Everybody has access to the Basecamp, and we're going to use this as the primary method for sharing information. We see that several of you are already doing it. This is your opportunity to ask questions of your colleagues as well, kind of you're sharing information about what you're distributing to campuses. But also, as you receive information, if it's from the Department of Public Health or Centers for Disease Control, feel free to share it as well. These changes, again, are occurring quickly, and so sometimes through other groups that you're involved with, you make the information as it comes out. Feel free to share that on Basecamp for everybody to see. I do request that you're careful about the source of information you use to share from, because there has been a lot of misinformation that's been out there, and it's come from various groups and organizations. So we do want to make sure it's been vetted before it is posted for everybody to follow. But by all means, please use the tool for your benefit, the Basecamp, and share information as well as we hope to push information out from that. If you're having difficulties with Basecamp or need some assistance with it, please contact me. You can send me an email, and we can work with you one-on-one just to show you how it works. One thing I do want to let you know, when you receive an email from Basecamp, the email address will show as it's coming from the individual, and then next to it, in parentheses, it will say Basecamp or Infectious Disease Group. When you reply to that message, remember it replies to everyone in the group. So be looking for that as you get information in your inbox. Look for that in parentheses next to the name, and you'll know that when you click on reply, it will go to everyone. If you want to reply to that person individually, then just forward the email and then enter their email address. Now, we want to make sure, at this time, the coordination with the Georgia Department of Public Health, you're going to hear that again and again and again. It's really important because as far as the legal authority goes, they are the only ones that have the ability to issue isolation or quarantine orders, and that's through the official code of Georgia 312A-4. Also, your local health departments have the ability to issue these same orders, and they will do it in conjunction with the Department of Public Health. And there is a form that they use to do that, notify the individual, and that they keep on record. When it comes to enforcing a quarantine, for example, if an individual does not want to cooperate with the quarantine order, then the Department of Public Health is the lead in getting that person to comply. They will work with local law enforcement wherever that individual is. And again, it's really important to understand that they're the ones who have the authority to do this. It's very complex when we talk about the legal issues, and so it's very important that we follow that. We've had some questions in the past about us quarantining students ourselves, and we need to remember that we do not have that legal authority to do that at this time, and so we'll have to work with the Department of Public Health in those type orders and those type situations. I do want to make a reference here. We've had some comments for somebody who's in the Category 2 that may come back and monitoring. Again, the Department of Public Health will look at those folks individually, identify what their goals, what they're doing, what movements they're going to have, and they will advise them on what's a good practice or not. In some cases, this is not going to prevent these individuals from coming to campus, returning to work, or participating in classrooms. And we need to be aware of that, and we'll, again, work closely with the Department of Public Health to make sure we all understand any restrictions that may be placed on that individual or activities that they may not be able to be involved in. But we do want to make sure that folks understand we don't have the authority to force someone or refuse someone based on their returning from travel from an affected country. Now, again, the notifications, when we receive these from the Department of Public Health, at this time, they will contact us at the system office and let us know. We will share and gather better contact information from all of you, update that first, but they will also reach out to the institution potentially. We'll make sure that you're notified so that you're aware, and then they will work with y'all on anything, any kind of restrictions or anything they may have. And you can share that information as they decide you can. It's also important that if we have somebody infected with an infectious disease, such as meningitis, the Ebola virus, the Department of Public Health will work with you to make notifications to the campus community. And as you're aware, we always get concerned about HIPAA violations of sharing information about somebody's medical history or their health status. Again, the Department of Public Health has the authority to share information under certain circumstances, and so they will take that lead. And as some of you are aware, at some of our campuses with other diseases, they have done that. And they have created announcements that you can share with the community, etc. So don't feel like if something occurs that you're going to be alone. They will be there to assist you in how you notify the community, how you contact folks that may have been exposed, and the Department of Public Health will take the lead in those areas. Again, you'll need to assist them as they do that. I would ask, if you have any potential cases, the first step is to notify the Department of Public Health. But we'd also ask you to notify us if you have any potential cases reported, or if you have any programs where travel to the affected countries will occur. At this time, we are not aware of any travel. We know there are some programs, international programs at the campuses that were scheduled to travel to these countries, but have since been canceled. On the other side of the coin, we understand there may be some folks involved in the medical field that may travel to these countries specifically to assist. If that's the case, please let us know. We're not aware of any that are actively planning on traveling there at this time. And I do want to share with you one thing from our review, and if it's incorrect, please let us know. At this time, we're aware of maybe one or two students that are traveling or that are attending our campuses that are from an affected country. So we only have a couple of folks that are in that category. We are aware that we have several students that are permanent U.S. residents that come from these affected countries, and they are attending our campuses, and they may travel to and from these countries, and that's why we asked y'all to send a notice to your campuses. So at this time, we don't have a lot of students in these programs that we're aware of, but we are aware there's several hundred that may be from these countries but are currently permanent residents of the United States. Okay, bear with me just a minute. Somebody's having a problem. Let's see if we can get them connected. Okay, just a minute. We'll start taking your questions. So you're welcome to send them through the Q&A function, or send me a note if you want to talk. I think we have enough people that we can probably do that. I just need to make sure that we unmute everybody. Again, with the notifications, if you have other issues or concerns on campus that may come up related to this or other infectious diseases, please make sure we're included in that. Your overall infectious disease plan, we encourage that should be an appendix to your existing emergency operations plan for the campus. So make sure that you involve your emergency operation coordinators to be a part of that. your working group, just so they can make sure they format it in to the existing emergency plan or update the existing plan appropriately. And this is also a good opportunity to review how you would respond to other infectious diseases or infections. As you're aware, I think recently Emory had an incident that impacted their campus. So we not only need to be looking just at Ebola, but we need to be looking at these other areas. Have a question about, can we get a copy of the PowerPoint? Sure, we can send that. We'll post that on Basecamp when we're done. Make sure that's available. This actually is dated, but if you have questions, please send them through the Q&A or send me a note and we can open the microphones. I'm going to go ahead and do that now. So if your phone is not muted and you don't have a question, you may want to make sure you mute it at this time. Okay, everybody's been unmuted, so if you do have a question, please feel free to use your phone or microphone. Okay, I have a question. Is there a model plan endorsed by the university system or Department of Public Health? No, the plans that most institutions have had prior to this, primarily targeting pan flu, generally meet the requirements that are needed for any infectious disease plan. And of course, the other piece to this is it varies based on what the institution's resources are and their exposures. One thing we would ask is that you include in there maintaining points of contact for the various groups or stakeholders on your campus, and to make sure that you have information available that you can share with the community as far as awareness campaigns. At this time, many of the campuses, most of you are already trying to encourage folks to get flu shots, take precautions to prevent the flu. Can you share a list of other campus coordinators' points of contact? That information is actually in Basecamp, and you can reach out to them through Basecamp. When we get the list compiled, we'll post it there as well. Is anyone else notified Department of Public Health? Is there a potential Ebola suspect from our campus arriving through Hartsfield, such as the president of the university? At this point in time, they will notify us, and we will in turn notify you as the coordinator, and we would expect that you would make the notifications to the appropriate folks on campus. Of course, we need to be probably limited in that distribution list, but probably sharing with your presidents, your health clinics would be appropriate to do that. And since we have not had one of these notifications made as of yet, we'll also see additionally what they do as this comes. We do want to emphasize, kind of like Dr. O'Neill from the Department of Public Health emphasized as well, again, it's based on these folks, interviewing them and what responses they have when they arrive back in the country. So we do want to be aware of that. Hence the other reason why we asked y'all to reach out to your communities and provide a point of contact. I have another question. Can we show all the questions being sent in the webinar? I don't think I have the ability to do that, but it doesn't appear that it's going to let me show all of them, but I'm reading them as they're received. Has anybody at this point in time not notified their campus? Have not notified their campus of a contact person for travel? I know I've seen just about every institution submit one for review, but I don't know that we've gotten them for every institution. I hear a lot of you typing, but I'm not getting questions. I assume you're responding to emails. If you have any questions, please go ahead. Y'all are too easy. You don't have enough questions. Well, unless there's other specific questions, feel free to ask those or contact me individually if you need to. We will be sending out a survey here shortly that will ask y'all to identify if you've completed the steps that we've talked about, just to verify that you have, so we have that information. I will tell you this continues to be a very dynamic situation, as you're aware. We still have some conference calls coming up with folks with the state and others to continue coordinating responses and identifying next steps. If there are any changes, we'll make sure we get that out to you as soon as we can. In the meantime, we would ask that, of course, be aware that the travel, the holiday season, and again, we're going to need to look forward towards the Christmas break, that it may be a good time in mid-December to send another reminder that folks can share information. Again, if you have any changes in your status as far as any programs that are going to be traveling to these affected countries, please let us know. Even though it says non-essential travel, that does not restrict anybody from traveling to these countries. And we know that some campuses have talked about there may be some medical missions they may have, but we're not of any of those being finalized at this point in time. And also, if you have an opportunity when you meet with your group the next time, just take a moment to kind of just review the other areas to be concerned about as far as other infectious diseases. Maybe take a few minutes to do a brief hazard and vulnerability assessment as to what you face, residence halls, etc. And make sure you include residence life in your groups as well. Unfortunately, several of our residence life directors have had experience in responding to cases of meningitis and other diseases which have unfortunately sometimes have resulted in death. So it is important to include them as well and understand what they do and how they respond in the campus setting, the residence hall setting. Unless there's any specific questions, that concludes the information we just wanted to share today. Told you we'd try to keep it brief. I will remain on the line for a few minutes if you have something specific, or feel free to give us a call if you need to. Again, folks, thank you for taking the time to participate in this and to serve in this role for your institution. Hope everybody has a happy Thanksgiving. Hope y'all are getting ready to take a few days off and rest and relax. Thank you.
Doesn't have a student health center. So who would we contact locally? Because I'm seeing a lot of the emails that people are referring their students to their student health center. So who would we refer them to?
Your local healthcare facility, I would recommend that you contact your local health department.
Okay.
And then identify who they may consider would be appropriate to handle that type, case. Of course, for health centers, if somebody is presenting the symptoms and they're in a risk category for having Ebola, we would probably not want them to come to the health clinic either. But, for general referral, you can refer them to folks. Just make sure you identify who they suggest.
Gotcha. Thank you.
Bruce, this is Suzanne Letter from Georgia Perimeter.
Hey, how are you? Go ahead.
Hi, good. I have a question because we closed the health center for 2 weeks at Christmas. So what do you suggest we do, as far as reporting for faculty staff during that time we're closed?
Well, hopefully about them contacting you to report any travel they may have had.
Correct.
Well, if they can, given them contact information, they can send you an email, etc. That would be important. Again, it's going to depend on how they're classified by the Department of Public Health.
Yeah. Okay. All right.
Etc. And again, if somebody, I was here, one of my colleagues had the experience. They went to their medical office, and there was a sign on the door that if you have these symptoms, don't come in. So again, it might depend on your health center. You may not want somebody who's exhibiting symptoms of Ebola to be in that high risk category to come to your health center.
Thanks.